Hi everybody, this is Matt. We are going to venture into now a very kind of long-term multi-staged presentation, and today we're going to do an overview of Know Your Heart, the conduction system. So we talked about in the last presentation about the electromechanical pump aspect of the heart. That is really what it is by definition. So now we're going to go into the electricity, the nuts and bolts of how electricity originates in the heart, how it's conducted, how it works when it works well, and how it works when it doesn't work well. So anyways, and also this will be a very brief lesson in German, because when I worked in Germany, I bought this book, and we'd like to thank Professor Sesto from the University of Mannheim, which is down near Heidelberg, for this Arrhythmia Compendium number 2, or number 2, and there is just a tremendous diagram in here that I will present and translate so that you can get the overview that we're going to cover today. And that'll be it. And then the next presentations will go into much more depth about each individual part of the conduction system and talk about how it would operate normally and how it operates in abnormal conditions. So here is our overview. And what this also does, which is very elegant, is that the signals that are associated with the particular parts of the heart's conduction system are associated with the surface EKG, which is at the top. I'll just kind of pan in on that. Also known as the Oberflächen EKG, or the surface EKG. So if you let me just pan down so you get that concept of what they're doing here in this diagram. We go from the sinus knoten, which is the sinus node, and you see the arrow pointing to it in the heart. And then there's the electrical system, electrical signal that it generates. And if you follow that up to the surface EKG, you can see where that signal originates or is associated with the surface EKG. So that's a wonderful teaching model. So anyways, we'll start at the sinus node, the sinoatrial node, which is the pacemaker of the heart. You see, anatomically, it is at the top of the right atrium and the base of the superior vena cava, and is positioned actually laterally. Then, moving along, we have that circle is the Vorhofmuskulatur, which is the atrial muscle, and the electrical signal as it is passing through that part of the atria. Going down further, we have the AV knoten, or the atrioventricular node, the AV node, which is at the juncture of the atria and the ventricles. Going down further, we have the His Bundelstam, or the His, the bundle of His, as it's called in English, and that is the predecessor or the spot that precedes the beginning of the bundle branches. So, and then continuing down further, we have, it's not included on here, but after the bundle of His, if you look closely, it's kind of like a fork in the road. After the bundle of His, If you go left, that is the left bundle, and logically, if you go right, that is the right bundle. And continuing on with the electrical signal, you have the Purkinje fibers that are the initiation of the electrical system into the musculature of the heart, the ventricular wall, and actually the very last little signal at the bottom is the ventricular muscle itself, indicated by that circle. And that is the entire conduction system of the heart. And like I said, that was presented very nicely because the individual parts of the conduction system are associated with that segment of the surface EKG, and the surface EKG is the fundamental way that we look at evaluating how the electrical system, the conduction system of the heart is working. So that's a start. And what we'll do in the future presentations is break it down, look at each of those different components in detail, and kind of get a little bit deeper into how the conduction system works, and how it works normally, and how it works sometimes abnormally. Okay? And that's it for today. Have a good day.